At a cost of $4.2 million, the new Washington County Crisis Stabilization Center will soon open its doors. Washington County donated the land, the state funded the building, and a generous donation from Intermountain made it happen.
You all know how costs have gone up since 2019, and so we are really thankful that once again the state legislature came through and helped us so that we could finish this project.
A ribbon-cutting ceremony celebrated the opening of the new facility, which was welcomed by state and local dignitaries, as well as law enforcement and healthcare professionals.
This will be open 24 hours a day, 7 days a week, 365 days a year. And I truly hope, as much as this helps law enforcement, it's going to help our families even more.
Operated by Southwest Behavioral Health in Washington County, this new center will fill a much-needed void in the community and 5 counties, so they don't have to go to the hospital or to jail during time of crisis.
We just want productive members of society, and if getting them treatment versus putting them in jail or having them go through the court system is the better solution, then we want to utilize that.
This is where people from the community come into our facility, and then over here we have our law enforcement entryway.
A quick tour of the new Crisis Stabilization Center by Director Chris Charter shows the 2 entrances where those in need will enter.
So what we would do in that case is we assess them, make sure they're appropriate for our facility. We interview them. They'll have a nursing assessment and a mental health assessment. And then once we've deemed that they're appropriate for our facility, then we'll take them back into the 23-hour area. So this is a 23-hour area, so everybody that comes in can stay in one of these recliners for up to 23 hours, and during that time we're trying to help them in their crisis and get them engaged in community resources so that they can get some help with substance use or their mental health issues.
This is not a locked-down facility, but a voluntary crisis center for mental health and substance abuse issues.
And then they'll be interviewed by a nurse and have a medical clearance, and then a therapist will talk to them just about what's going on, what do you need. And from the time they walk in, we're working on what's a good discharge plan for you? How can we help you get out back in the community and be stable?
This crisis facility is one of the largest in the state, and for those who do need a longer stay, there is a dining area, a kitchen, living room space, and 16 bedrooms for sleepovers.
So here's one of our individual bedrooms, and we'll have a men's hallway and a women's hallway.
If somebody is doing well, but they need to get in a treatment center and they can't for a day or 2, we have 16 beds available that people can stay in short-term till we can get them into a longer-term treatment. The other centers in the state are having about 50 to 70% of people dealing with addiction, drug problems, and we're doing social detox here, meaning we don't have medications, we don't have round-clock nursing. We will have nurses here, but it's not a medical detox. It's considered a social detox.
Clients can then be referred to the appropriate help after they leave.
If it's felt that they need that higher level of care, like a psychiatric inpatient admission, certainly they would look at bringing them over to us, and we would facilitate a hospitalization.
If somebody's having a crisis, we give them a safe, comfortable place to come and a choice other than the hospital or jail.
Supported by legislators, Utah plans to open more facilities like this across the state in the future.
Other places in the country that are doing this, but very few. We've learned from them. We know that it works. We have one in Davis County. We have this one. We have others opening up. The legislature has funded several of these across the state, and we're hoping to add more all the time.
And it's becoming more and more prevalent in our community, so having a facility like this is just critical in maintaining and keeping that balance and having a place to treat people and get them back out and being productive in life.
They'll get to interact with others with the same problem, and I think we're on to something here, and I hope it works, because I was impressed with the tour.
During the ceremony, builders and contractors were given plaques in honor of their dedicated work.
So I just want to point out, as you can see, the team has done a tremendous job creating a beautiful building that feels so warm and welcoming. So thank you for a job well done.
For every commissioner, council member, mayor, community member who knows somebody who has had those moments of crisis, there is another tool in the tool belt now.
Besides Medicaid, Lindsey said the new center does not accept insurance, so those who come won't pay anything. The new Crisis Stabilization Center will open its doors to the public on September 5th. In Hurricane, Melissa Anderson, Community Education News.